Hello friends, let us now learn some important points about the drug Nicosamine. These Nicosamines are used mainly in the cystodes. This Nicosamine will inhibit the oxidative phosphorylation in mitochondria. So because they inhibit oxidative phosphorylation, they interfere with anaerobic ATP generation, and thus they will injure the tapeworm and they will kill the tapeworm. They will injure the tapeworm and also they will kill the tapeworm. If you see the pharmacokinetics of Nicosamine, this has minimal GI absorption, so there is no systemic toxicity associated with it. The side effects of Nicosamine include: it is a tasteless, non-irritating drug. It causes malaise, pruritus, and it also causes lightheadedness. Then this Nicosamine also kills the adult worms. This Nicosamine will kill the adult worms, but it does not kill the ova. It mainly kills the adult worm. Here the ova are released, so it causes visceral cysticercosis. And this is used in the treatment. It is used. See, here this Nicosamine will kill the adult worms, true, but it does not kill the ova. So once the ova are released, it will result in visceral cysticercosis. The treatment of this visceral cysticercosis is, in this, saline is injected into them in order to kill them. So this Nicosamine is not used for Tinea solia because it causes visceral cysticercosis. The next important drug is Prasa Quantile. This Prasa Quantile causes leakage of intracellular calcium from the membranes. It causes leakage of intracellular calcium from the membranes, causes contracture and paralysis. It also causes loss of grip of intestinal mucosa, and as a result, because normally the worms are attached to the mucosa, right? Now once this Prasa Quantile causes contracture and paralysis of the worms, now the worms, because of the paralysis, they can no longer catch the intestinal mucosa. So as a result, they get detached from the intestinal mucosa and they are carried away by the stools. So thus they are expelled out. So severity of action is, this Prasa Quantile action mainly depends on the presence of specific variants of calcium channel. Severity depends upon the presence of specific variants of calcium channel. Pharmacokinetics are, these are rapidly absorbed from the intestine. The absorption of these drugs will increase with food. They have higher first pass metabolism in the liver, and these drugs also crosses the blood-brain barrier. They cross blood-brain barrier and they reach the therapeutic concentration in the liver, in the brain. They cross blood-brain barrier and they also reach the therapeutic concentration in the brain. Side effects are, they do not cause any systemic toxicity. They have bitter taste, and they also have some GI side effects, and they cause itching. They cause symptoms like itching, urticaria. They also cause symptoms like itching, urticaria, rashes, fever and body ache. So these drugs can penetrate the blood-brain barrier and cause destruction of cysticerci in brain. And they cause destruction of cysticerci in brain, leading to the neurological complications. So this is about the Prasa Quantile. So thank you guys for watching my lecture. Thank you.